Yes, yes, he's
Okay.
here. Yeah, maybe in a different name. That
Yes.
might.
Hello, Mehul bhai. Can you hear
Hello.
me?
Yes, we can. Loud and clear. Thank you so much for joining. So, ladies and gentlemen, participants and speakers, good afternoon and a very warm welcome to all of you on behalf of the organizers. This particular webinar, titled as Mental Health and Psychosocial Impact of Heat Waves, is jointly organized by Sphere India, NIDM, the All India Disaster Mitigation Institute, and Vardhaman Mahavir Medical College. So these partners have come together to organize this particular webinar. And I must say, today's webinar is very timely, as right now various parts of our country are going through extreme heat periods. And every day we are reading in our newspaper that the temperature is breaking the past records. Recently, Delhi was in the news, not for a very good reason, but because of the extreme heat in Delhi. And why this particular topic is important is because as individuals and families and societies, in general, we are more concerned about physical health, but we are less concerned about the psychosocial aspect of our well-being. And that is the reason why this particular subject, which is really important, is often overlooked. And it happens not only in the times of normalcy when everything is going fine, but even during the periods of extreme weather conditions and natural or man-made disasters, this particular aspect is often overlooked. And don't often participate in webinars or seminars that specifically talk about psychosocial aspects of disaster impacts or impact of extreme weather. So this particular topic or subject is extremely relevant, not only in our professional lives but also in our day-to-day life. And another important aspect that I would like to highlight in the beginning is that we don't often realize, but climate change is fueling a silent mental health crisis across the globe. Rising temperatures, extreme weather events, uh, climate induced displacements, crop failures, they all lead to mental crisis and mental illness. But we don't often, read about, how extreme weather events are affecting our mental health or the mental health of the poor sections of our society. And we have experts and they will talk about impacts of psychosocial impacts of heat waves. But I would like to highlight or share some examples of how heat waves impact our socio-cycle impact our social lives and also our mental health because of extreme heat or heat waves. Physical discomfort and fatigue is something that we all experience. We also experience sleep disturbances or sleep disorders during the periods of extreme heats. We feel mental stress. Uh, Research have been conducted and they have found, and there is an evidence that extreme spell of heat waves they often lead to increased violence. Also, domestic violence against women they rise because of extreme heat. We have also witnessed rising numbers of divorces, and we have also observed social isolation, especially for the elderly during the extreme heat periods. We have also read in newspapers about suicides, and studies have also found that heat could also lead to civil war-like situation. It could also lead to internal conflicts and riots. So these are some of the impacts or socio-cycle impacts of extreme heat on our society. And most important thing that we must remember is that heat waves they don't affect everyone equally. So different demographic groups are affected differently. So our strategy to mitigate the impact of extreme weather conditions or heat waves must be tailor-made to cater to the needs of these different demographic groups. And to talk about these strategies and the differential impact, we have with us today Dr. Anil Gupta from NIDM, and he will be speaking about community resilience and social support systems during heat waves. We also have Dr. Sahil from the Wellness Program Coordinator from SEVA, and he will be speaking about mental health and social impact of heat waves. And last but not the least, in the end, we will hear from Dr. Jayakumar C., Additional Professor, Department of PSS in Disaster Management, NIMHANS. And the title of his presentation is Strategies for Mitigating Mental Health Risk During Heat Waves. So this is the structure of our today's program. And I would like to invite first Dr. Sahil to make his presentation. Thank you. Dr. Sahil, may I request you to share your screen? Thank you. Dr. Sahil, are you there?
Um, am I audible, Mehul bhai, now?
Yes, you are.
Okay. Namaste, everyone. I'm Dr. Sahil Hebar. I represent the Self-Employed Women's Association. I've been a part of SEVA for over 4 years now, and I lead all the health and wellness initiatives. Just to provide some overview of the organization. So SEVA was started in 1972 by Srimati Ilaben Bhatt, and it's an organization of poor informal sector women workers. So today, SEVA organizes almost 2.9 million members across 18 states in India and some South Asian countries. And our members belong to 102 different trades. So we have home-based workers who are basically garment makers, BD rollers, artisans, incense stick makers. We also unionize vendors and hawkers, so people who sell vegetable, fruits, cutlery, ready-made clothes, etc. We organize manual laborers and service providers. So these are women who are engaged in farming, construction work, waste recycling, masons, etc. And finally, we also have producers. So they are micro entrepreneurs who produce and market their own goods. So over the last 50 years, SEVA has basically worked with the twin goals of full employment and self-reliance. By full employment, SEVA refers to employment that provides work security, income security, food security, and social security. And by self-reliance, SEVA refers to an economical and equitable role in the decision making, not only within the households, but also in the communities that women live in. So over the last few years, the incidence and the frequency and the impact of climate change has really intensified. And unfortunately, the poor women workers from the informal sector are the worst sufferers. They always end up bearing a disproportionate impact, whether it's a natural disaster or a human-made disaster. And climate change is no different. So climate change impacts the livelihoods of members, the health of members, the education that their children receive, the energy security of women's. And all of these impacts ultimately has a deep and profound impact on the mental health of the woman. So just over the last 4 to 5 years, there have been several heat waves that our members have faced. There are multiple episodes of unseasonal rain and excessive rainfall. There's been cyclones, there's been floods, and all of them actually end up having 3 or 4 significant impacts that result in increase in anxiety and depression among women. One is the loss of livelihoods and the drainage of the family savings. The second is the threat to the safety, to their homes, to the loss of various limited assets that they have. The third is the impact on health and the out-of-pocket expenditure that most of these climate change episodes cause. And because of the out-of-pocket expenditure, again, the limited family savings is drained, and that becomes a huge source of anguish and anxiety for women. And finally, whenever there is a heat wave or a cyclone or a flood, the children's education is impacted, as well as the food security that the informal sector women have is impacted. And a lot of times it's a tough choice between feeding themselves, feeding their families, feeding their children, or maybe procuring something that helps them with their day-to-day livelihoods. So it's these tough choices that really increases the feelings of grief, of loss, of depression, anxiety, and post-traumatic stress disorder among women. As Mehulbhai earlier alluded, the impact of mental health issues is generally seen either in the form of gender-based violence or in the form of substance abuse. And over the last 4 to 5 years, multiple SEVA members across different states, across different trades, have complained of either GBV or of substance abuse. And the final point that I want to make with relation to the mental health issues is women often bear the brunt of caregiving responsibilities, and the health impact from climate shocks can exacerbate these responsibilities, which means that they have to take care of any heat-related illnesses within the household, any waterborne or vector-borne diseases that arise after a flood or a cyclone, any other geriatric or elderly members within their households. It also increases the financial burden that women have to face. And hence, they have to borrow money at high interest rates from local money lenders. And often, this interest burden pushes them into the vicious cycle of poverty. So, climate change, in a nutshell, is causing significant impact on mental health. And the impact is directly because of the loss of livelihood, of health status, of any assets that they have, but it's also the indirect impact of the caregiving responsibilities that women have to face. Um, the other angle to mental health and climate change is the impact of climate change on the mental health of children. So we have seen similar effects in children as well, where they undergo severe anxiety, severe depression, PTSD again. And it's because of the loss of life, the loss of homes, of possessions, and a disruption to the routines. So when there is a climate shock, it generally results in displacement, in migration. And this disruption of routine causes significant impact on children, much more so than adults. The other key impact is closure of schools and extracurricular activities, and the failure to meet their friends or have that support system that a school provides also increases the cases of climate anxiety. So in terms of what SEVA has done over the past few years, I just wanted to share a couple of minutes on that. One is we have trained a cadre of SEVA health ambassadors. Over 400 women members from the community have been trained as SEVA health ambassadors. And they are trained not only on mental health, but also provided a very holistic 360-degree picture of health, where they are tackling non-communicable diseases, infectious diseases, routine immunization, exclusive breastfeeding, food and nutrition. So when there is a climate shock, these women immediately go to members' households, if possible. And if not possible, they at least try to touch base with the members through phone calls, understand the problem, provide a shoulder for the other women. And many of them are trained on basic mental health counseling. So they are able to understand and articulate what the members are feeling and provide the basic counseling to the extent possible. The other thing that Seva has done is that we have piloted a lot of data collection. So we have used tools like the GAD-7 and PHQ-9, which are well-defined, well-established questionnaires and help with the diagnosis of anxiety or depression. And we have piloted that among 3,500 women. And in our initial assessment, almost 20% of SEVA members are suffering from mild to severe anxiety or depression. Finally, we have established a network of physicians and a telemedicine system where members can call and at least have access to mental health counseling if required. However, because of various challenges associated with telemedicine and um, access to care in rural areas, I would say that the penetration of this particular initiative is limited as of now. So I'll stop there. Please let me know if you have any questions or comments.
Thank you so much, Sahil bhai. I request participants to share the questions, the chat box, or ask them in the end before the concluding section. And I really thank Dr. Sahil. What I understood from his presentation and the key message, if I have to highlight, is that the source of mental illness uh, could be many for informal sector women. It could come from loss of livelihoods or jobs or a crop failure, and as a result, we have witnessed in the field. And Sahil Bhai also highlighted how gender-based violence increases during the period of heat waves, substance abuse, something which he highlighted. And in terms of strategy, he shared two important strategies of training women. So women to women counseling could be used as a strategy to help women, and also the use of telemedicine, the technology, again to reach out women in rural areas could be really useful. So thank you so much, Sahil Bhai, for sharing Seva's experience. And now, our second speaker, I would like to invite Dr. Anil Gupta, sir. And he really needs no introduction. He is the head of division ECDRF at the National Institute of Disaster Management. Uh, Thank you so much, Anil, sir, for your presence today. I welcome you to share your presentation. Thank you.
Thank you, the past two speakers, very elaborate on the topics. I would not be using any PowerPoint presentation, but I'll be just giving a few points from my side, which I think are very important. The first point that I think that even if we don't talk about any significant economic losses, then also the heat has physical impacts that leads to mental lack of peace or lack of rest. And that is the point number one. I would like to stress that even if the person has least vulnerability in terms of losses of assets, but then also, and that is the reason during high heat days and during high cold days, both, the number of accidents in workplace and also the number of accidents on road and any other kind of occupation environment also that increases, because the extreme temperatures, both ways, extreme the increasing temperature as well as the chilling temperature, both lead to decreasing precision or decreasing the ability to decide decision making by the person. So this is point number one, and this has been statistically also seen that how this kind of incidences increase. So this is point number one. Second thing, the health impact to any of your family member, even if there is no economic damage, that can also make the other person to be at lack of rest or lack of mental peace. So there are all three type of mental health impacts that we witness. The one is very short term mental impacts, which are not permanent kind of mental impact, but those may have lethal or sublethal the consequences. Because if those are associated with some kind of decision making, some kind of operations, and may lead to some kind of accident also. So within industrial environment also, this becomes a very important dimension, that how exposure to high heat and what to how long the exposure to how heat in the occupational environment and also into ambient environment the person can sustain, and this person's sustaining our person's resilience includes his precision and mental health, very important dimension. And second is the short-term impacts, which are of reversible nature. So there are certain kind of challenges, but with when the person gets some rest, so we can say that he has some good level of resilience. But the third dimensions where the exposure is not very high, but continuous exposure. So those kind of exposures are also there. So all the three kind of exposures we can see when we talk about the mental health challenges or mental health illnesses associated with the heat exposures. Second, as the previous speakers also referred, that because of the loss, the economic losses and economic vulnerability, because of debts, the persons undergo these kind of challenges, and they are under continuous worry. And we also have seen that during heat wave conditions, that is also substantiated by data in many of the cases, the crime rate also increases. So this kind of when people are they bound to undergo debts, but sometimes they don't get any kind of finance or money on loan also, because if they are taking continuously, they are borrowing money every time they don't get. So the crime rate also increases. And in the low economic colonies or industrial areas, we find that during high heat conditions, the uh, uh, number of small crime incidences, snatching, looting, these also increases. And even in the urban areas, we witness these kind of things. So looking at mental health conditions and a relationship with heat wave requires a multi-layer consideration. And I think it also calls for looking at law and order situation. It also requires to look at what kind of counseling and awareness is required, what kind of social protection measures are required. And when we talk social protection measures, then personal, and then the household level, and also the social protection measures. So these are few points I just wanted to tell. This is very important dimension, and today we are discussing this kind of thing. So how the mental health conditions will play both the sides in preventing the losses or damages from heat wave, in providing protection people, but also that how do we give some kind of care to the people who are affected by these kind of things. So thank you very much, and over to you for further discussions.
Thank you so much, Anil sir, and thank you so much for sharing your thoughts on socio-psychological impact of heat wave on populations. You talked about direct and indirect impacts of heat waves on individuals and families. And you also mentioned how they could be mitigated with appropriate prevention and care. Sir, you also talked about medium term and long term impacts of heat waves on our society and how we can take steps or measures to reduce the risk during the periods of extreme heat. So, thank you so much for sharing your experience with our participants today. Uh, third presenter we have with us is from Nimhans. Now, I would like to invite Dr. Jayakumar C, Additional Professor, Department of PSS in Disaster Management, Nimhans. And he'll be talking about strategies for mitigating mental health risk during heat waves. And before he starts his presentation, I would like to again request participants to post their queries and questions in the chat box. Thank you. Dr. Jayakumar, over to you. Thank you.
Thank you, Mehulji, and very good afternoon to each one of you there out there who joined us in this a very important and very contextualized topic to discuss in the present times. I actually coming from NIMANS, people may be knowing about NIMANS. I represent a department which is an exclusive and specializing in psychosocial support in disaster management. And NIMANS is being Government of India's nodal agency for psychosocial care. I mean, we have been actually taken through in this aspects, both natural hazards and or human made incidents. So with this one, so heat wave, the esteemed speakers, the earlier esteemed speakers were talking about heat waves, and absolutely Delhi is scorching and North India is scorching, and fortunately or something, I am in Bangalore here. The temperature is actually unbelievably, it is very cool here. But so these sort of events, the weather extreme weather events are actually going on in our own experience. And India has been also increasing this sort of temperature, increase in temperature from time to time. We have seen back in 2003 and 2005 number of casualties in many of the states, especially actually I would like to recall Andhra Pradesh, which recorded more than 3,000 casualties in these years. So again, actually, we are actually going into this heat wave sort of a thing. And heat wave is heat is actually always related to a sort of a negative. In Hindi they say actually dimag garam ho raha hai. So so you don't feel good actually, that it is a very unpleasant sort of an experience. So the heat word itself is actually that not at all good. So it has actually a lot of negative connotation. So I mean, the earlier speakers were talking about it. So heat wave, it is happening, it is going on, and time to time it is happening. All of us actually have a certain amount of threshold to actually withstand heat. I mean, people say actually that above 40 degrees is actually that they declare it as a heat wave, and our body, I mean, our ability to withstand these things actually also actually goes for a toss. So coming to actually that all of us are affected by heat waves or extreme heat, increase in heat. So who are all actually at risks? All of us are at risk, and today we are talking about heat stroke and all those things. But among them, the mental health context is very very important, because mostly we speak on the physical context. People get heat stroke, people are dehydrated, people fall sick, and people had so many other things. But one of the invisible component is this mental health aspect, and today more and more people are talking about this, because it has actually a larger repercussions on the well-being of the people. So heat heat or heat wave or increase in heat definitely has an impact of people's well-being. So it can actually take this people's well-being towards downwards drift. So there are many factors which actually I could actually quote, but three things I would like to actually mention here. One is the vulnerable population. Three things are actually important. One is exposure, second is sensitivity, third is the ability to respond and prepare. Exposure. So some people are more exposed to high temperatures than the others, like people who work outdoors, like people who are homeless, people who don't have actually all the gadgets like air condition. So people who are from the low socioeconomic strata. So the exposure actually also actually making them vulnerable towards not only the physical ailments, also exposing them to high risk of mental health issues. Second, the sensitivity. The infants, young children, pregnant women, older adult, people with certain health conditions. So these are all actually people who are actually maybe immunocompromised. Some of them are compromised. Some of them are immunovulnerable, or some of them are actually already taking medications. So these people, these sensitivities, also actually making them vulnerable towards mental health issues. third is the ability to respond and prepare. Some of this population who may not be in a position to ability to respond or prepare in such events, like peoples with disabilities or elderly geriatric population, like the other speaker was mentioning. So these are all actually a very, very general sort of an understanding that these three groups are most vulnerable. Added to that, who are all the other vulnerable groups who may have higher risk of actually having mental health issues? One is people who are already mentally ill, who are already taking medications for various ailments, maybe actually a schizophrenia, maybe a bipolar affective disorder, maybe an OCD, or maybe a depression, maybe for anxiety, or maybe for any other ailments, mental health issues. They may be actually already on medication. So these people actually have maybe at higher risk. I mean, I would say that there are a number of studies which actually quoting that it triples actually that their rehospitalization. It means the relapse can occur more. So the more hospital visits or more hospital admissions actually may be occurring among this population. Added to that, people who are actually using substance, people who are actually taking alcohol or increased alcohol during these sort of this one, or may are also actually in a position actually to land up more trouble in the mental health domain. And added to that, research also actually talks about some of the early speakers were talking about aggression. So it may be actually of an individual sort of an aggression. It may be a group violence. So nowadays we see actually number of road rage incidents are increasing, and there are actually a number of studies and reports are stating that hospitals in Delhi and Rajasthan reporting 5 to 10% increase in bipolar disorder cases during peak summer months. And also the relapse and hospital admissions are, I mean, raising by 30 to 40%. This is, I'm not talking about, I mean, there are actually studies actually just quoting due to the climate, I mean, the weather, I mean, heat, due to heat. And also the already I was talking about people with predisposed mental health issues. It is also this heat also actually can exacerbate symptoms of mental disorders like depression. So maybe actually they may be actually recovering, I mean, on the path to recovery or maintaining stability. There are actually high chances that they may slide back actually that again. And also uh, high stress also can lead to cognitive impairment and increased irritability. So this is actually that it is a very general understanding that obviously when the temperature is high, when you don't have actually a proper facility infrastructure and all these things to actually able to withstand these things. So lack of sleep can actually disturb many things. One of the thing is that next day you won't feel fresh, you will be irritable, you will not be in a position to focus, or you will not be in a position to deliver actually the kind of functionality you used to do it when in a normal sort of a bearable sort of a temperature. So the functionality aspect. So here, actually, I would like to quote here is that the dysfunction actually sets in. So you don't function as though. So all these things actually also have repercussions not only on the physical health or a psychological health, even actually at the economic health or a social health or an occupational health of the person, and to large extent even at the family level or at the interpersonal level. You don't feel like talking, or you get into quarrel or quarreling with people or fights. So these things actually has been very, very actually common during these sort of things. And there are actually studies also actually quoting that the mortality risk. So here actually that the more, of course there are increase in mortality, but the morbidity, risk of people going into these sort of illnesses or mental health issues is higher during this. So another aspect which I was talking about, and I think the first speaker was also talking about, and this Dr. Gupta was also talking about the violent crimes actually that. So this these significant correlation. There are actually studies also actually talks about significant correlation about people's behavior. So it is just not actually the cognitive aspects, the feeling aspects, it is actually also the behavior aspects also actually comes into play in this sort of high temperature this one. And so elevated temperature can disturb sleep patterns, leading to sleep deprivation, which is a known risk factor for various mental health disorders. So altogether, to sum up, so when your sleep gone, your day is gone and your things are gone. So there are actually other aspects that people can actually also feel it, that perception about not achieving the targets. Like I said, the dysfunctionality sets in, so you don't feel like actually working, you don't feel like actually performing, delivering. And also it takes longer time because you have not slept, your basic biological function went for a toss. So absolutely you are no longer completing the task, and absolutely loss of wages, absenteeism. We have seen actually frequent attrition rate among the in the informal sectors, even in the government sectors, in the formal sectors also actually this happens. But absolutely the vulnerable population is not inside actually the AC offices. People who are actually outside and facing the elements, and difficulties in concentration and decision making. So the ability to take decisions, ability to focus on these things also actually goes for a toss. There are a number of guidelines that are available. So what is actually the strategies? There are actually, there's no clear cut specific strategies, if I would actually say, because mental health issues are actually taken a backseat, and nobody goes for only very specific sort of a things in during these days. So there has been guidelines right from NDMA to Pan African Health Organization to IFRC to everyone actually came up with the climate well-being guidelines. But so what is that actually, that we as a people who are non-specialist or non-mental health professionals, because this is actually the climate change or heat, we all have to actually handle it. You need not actually only look for the clinicians or the institutions to handle this. Each one of us actually need to handle this, because mental health and mental well-being is everyone's business, it is not the professional's business. So we need to actually have a comprehensive heat action plan, which actually not only covers the physical aspects of health of the person, but also the psychosocial aspects of the person. Like, what is that actually that you have to do it? First and foremost is that one should not panic. How you have to actually seek appropriate help, because number of actually support centers are available, resources are available. So what sort of resources are there? Because you can't actually just move out in this heat to a government hospital or an PHC or any other support providing care providing institution or facility. But how we can actually leverage and utilize the internet, more and more the mobile phone, and how we can actually get some easy tips. Because this, I'm not going into those tips actually directly, because it is available there, n number of them available on the YouTube or in the net. And so we need to actually first and foremost prepare an action heat action plan, whether it is for the schools or whether it is for the offices, whether it is for the workforce, or whether it is for the factories, or whether it is for the self-help group. So let us actually have these things. So we need to decentralize this, and we need to actually have launch a campaign to educate people about health related risks, just not about physical aspects. It is also actually psychosocial aspect, how it can actually change your mood, how it can change your feelings, how it can actually bring change into your ability to function. And because of that, where the repercussions, so the short term, long term repercussions need to be actually discussed with them and told them. And monitoring heat related illness and coordinating with healthcare facilities to ensure adequate preparedness. So we need to actually monitor. So we should not only monitor the temperature, or body temperature, or whether are we sweating, or are we tired or something. We need to actually also self aware actually, that are we actually getting irritated, are we not able to focus, are we not able to concentrate, or feeling fatigue. It may be actually due to dehydration also, or you are not interested actually in performing any task. So you have to change, look into your cognitive, behavioral, emotional aspects. So this is actually the strategies actually we need to actually more and more speak to the people, and targeted interventions for high risk groups such as elderly children, like the early speaker was talking about the loneliness. Absolutely, the elderly who are actually most prone during these sort of things are actually absolutely actually there is nobody to talk to them or tell them what to do. Even the basic protocols they don't know. So we need to actually have a targeted interventions which is actually already available. It is there with the professionals, people who are trained in this aspect. So we need to actually help them how to access, how to reach this. So accessibility is another issue in this, and integrate climate resilience into urban planning and infrastructure development. So let us not wait only till the March or April, May to come, then we do all these things. So why don't we actually plan it actually during the course of our yearly planning, or actually a quarterly review, or half-yearly in the factories, or for the non-formal sector. So we need to actually bring in, actually integrate. Psychosocial care is a cross-cutting area. So you need to actually integrate these aspects whenever there is actually, when you are talking about preparedness, disaster preparedness, risk reduction. So this needs to be actually brought in along with the other protocols available with the various agencies like NDMA, NIDM. Everyone has come up with the heat wave tips, basic do's and don'ts. So this is where actually that you need to actually mitigate. So at the end of the day, I would like to say here is that providing psychosocial care is one of the important aspect. So we have to actually keep our eyes and ears open to these populations. How are they actually functioning? How are they performing? How is their day-to-day lives going on? Is there any change in those parameters which I was talking about it? But there are actually very specific indicators also there, which I am not going to talk here in this now. So if you have any doubt, you can always scrap your questions to me. So I think actually that with this, I would like to take some questions from you. Thank you very much, Spare India and NADM, Dr. Gupta, who is actually very dynamic. Actually, he's bringing in these sort of important alienated topics actually to the forefront of the nation. And Spare India, as usual, actually at the forefront of taking the psychosocial care to the masses. And looking forward actually for more such discourses in the coming days. Thank you very much, one and all.
Kindly mute your.
Sorry. Thank you so much for the presentation, very informative and useful. और एक चैट बॉक्स से स्पेसिफिक रिक्वेस्ट आया है कि अगर हो सके तो ज़्यादातर हम लोग हिंदी में बात करें, ताकि ज़्यादा अच्छी तरह से हम लोग कम्युनिकेट कर पाए। तो मैं आप पार्टिसिपेंट्स को बताना चाहता हूं कि हम लोग प्रयास करेंगे कि जितना हो सके उतना क्वेश्चन आंसर सेशन जो है वो हम लोग हिंदी में ही कंडक्ट करें। और पार्टिसिपेंट्स अपना हैंड रेस करके क्वेश्चंस कर सकते हैं, चैट बॉक्स में भी क्वेश्चंस डाल सकते हैं। और एक क्वेश्चन मुझे काफी इंटरेस्टिंग लगा, एक्चुअली कमेंट है, रिकमेंडेशन जैसा है, सजेशन है, पर उसके हिसाब उसको पढ़ने के बाद मुझे भी दो क्वेश्चंस आए जो मैं पूछना चाहूंगा। साक्षी शर्मा लिख रही है कि हीटवेव के कारण बच्चों की एजुकेशन अफेक्ट होती है और जिसके कारण कोर्स उनका कवर नहीं हो पाता है और बच्चे बहुत मेंटली डिस्टर्ब रहते हैं, तो उसके लिए बच्चों की काउंसलिंग करनी चाहिए, ऐसा वो सजेस्ट कर रहे हैं। तो उनका कमेंट पढ़ के मुझे ये क्वेश्चन आ रहा है जया कुमार सर, कि अगर बच्चे डिस्टर्ब हो रहे हैं या उनके ऊपर साइकोलॉजिकल इम्पैक्ट है हीट वेव के कारण, तो उसको आइडेंटिफाई कैसे किया जाए। और अगर गरीब घर के बच्चे हैं, जो बच्चे म्यूनिसिपल स्कूल्स में जाते हैं, तो उन लोगों को काउंसलिंग अवेल कैसे करवा सकते हैं, उनको ये सब स्पेशलाइज केयर जो है वो हम लोग कैसे प्रोवाइड कर सकते हैं। थैंक यू।
डेफिनेटली जो आप बात कर रहे हैं, डेफिनेटली डिस्टर्ब तो होगा, बिकॉज बच्चों का रूटीन्स चले जाता है और उसके ऊपर एक आइडियलनेस आ जाता है, और आइडियलनेस आने के बाद आज का डिस्ट्रैक्शंस आप जानते हैं, मोबाइल और उसमें चले जाते हैं, फिर प्रेशर आ जाता है घर के बच्चे के ऊपर और पेरेंट्स के ऊपर और टीचर्स के ऊपर, सब मिलकर एक्चुअली एट द एंड ऑफ द डे बच्चों का एक्चुअली एंग्जाइटी बढ़ जाता है और परफॉर्मेंस नीचे चले जाता है। तो इसके लिए एक्चुअली दैट एक चीज़ हम लोग एक्चुअली सब पेरेंट्स और किसी भी एक्चुअली ऐसी हालत में है बोलते हैं, तो ये रूटीन एक्चुअली इवन समर डेज में भी एक थोड़ा बहुत एक्चुअली यू नीड नॉट एक्चुअली कीप 100% रूटीन ऑफ द चिल्ड्रन ड्यूरिंग द समर, बट एटलीस्ट 60% एक्चुअली एक रूटीन एक्चुअली रखना पड़ता है घर पे। और उसके लिए एक्चुअली आप फोर्स मत नहीं करना है, बट बच्चों के साथ एक्चुअली एक एग्रीमेंट कर लेना है। लुक एक्चुअली तुम इसके पहले 6 बजे एक्चुअली तुम उठते थे, बट आज तुम आराम से उठो, बट तुम्हारा एक्चुअली सवेरे को जो भी करना है कर लो, फिर जो भी खेलना है वो करना है, ये करना, लेजर करना कर लो, फिर बाद में 1 घंटा 2 घंटा फिर भी। तो ये रूटीन एक्चुअली मेंटेन करना है। तो एनीथिंग एक्चुअली दैट इफ दे लूज दैट continuity, then again actually it takes time for us to actually regain that. So इसमें actually so that is what actually that we explain that to the parents. So ये parents का actually एक जवाबदारी हो जाता है। तो बहुत सारा parents actually that okay आराम से छोड़ देंगे, now it is छुट्टी है, then after that it is very very difficult. So many times that is where actually that today आजकल parents actually ये routines को actually disturb नहीं करना। So that is one important aspect. Second is even gadgets also. Using the gadgets also, you need to actually have a dialogue with the children. Today आजकल I mean निमांस detox center, देश का पहला detox center चला रहा है, ये डिजिटल डिटॉक्स। तो उसमें एक्चुअली हम लोग बोलते हैं एक्चुअली दैट हम लोग डायलॉग करना है चिल्ड्रन के साथ, और पढ़ाई के टाइम में और खाने के टाइम में और इससे टाइम में मोबाइल को नहीं छोड़, आई मीन टच करना है एक्चुअली ऐसे। तो ये सब एक्चुअली थोड़ा फैमिली का रूटीन्स भी एक्चुअली ऐसे चलना है। तो दैट इज़ वन थिंग। सेकंड इज़ जो गवर्नमेंट स्कूल का बच्चे हैं, इनको एक्चुअली कैसे हम मदद कर सकते हैं। एक्चुअली काफ़ी एनजीओस मदद करता है ये जैसा बच्चों को एक्चुअली ये मानसिक रूप से एक्चुअली इनको एक्चुअली कैसे आत्मविश्वास बढ़ जाता है, बढ़ाते हैं, और कैसे इनको एक्चुअली कई स्किल्स को एक्चुअली सिखाते हैं। बट ज़्यादा तरफ एक्चुअली दैट इनको एक्चुअली ये फोकस नहीं होता है, बिकॉज फर्स्ट एंड फॉरमोस्ट स्कूल को एक्चुअली ये फोकस नहीं होता है। कोविड में मैं देखा है कई स्टेट्स में गवर्नमेंट स्कूल बच्चों को एक्चुअली nobody actually bothers about all those things. So but there are, I won't say actually that blanketly actually कोई नहीं कर रहा है, बट हमको इसको एक्चुअली आगे ले जाना पड़ेगा। जैसा स्पीयर इंडिया है उधर, जैसा आपका संगठन आई मीन ऑर्गेनाइजेशन है, कई एक्चुअली ऑर्गेनाइजेशन सेवा है। आई हैड अ अपॉर्चुनिटी टू वर्क विद सेवा ड्यूरिंग द गुजरात earthquake. So these are also well established people are there. So they should actually take it up actually that children's mental health, not only general mental health, these sort of situations, these sort of an issues. And today this digital dependence, digital addiction is going to be a major issue. Take my word, in next 5 years down the line, we will have more de-addiction centers for digital de-addiction centers than the other alcohol de-addiction centers, and it is already actually coming up. So yeah, actually this is actually point for all of us to ponder and reach out. So accessibility of the services care actually needs to reach out to these people. In a way, government school children also more vulnerable, I would say.
Thank you so much for the comprehensive answer. We have another question from Hannah, and I would like to request Dr. Sahil if he could respond on this. She is asking that what actions can NGOs and CSOs take up to help mitigate the mental health impacts of heat waves, and she is also asking that on the individual level, व्यक्तिगत लेवल पर हम लोग क्या कर सकते हैं ताकि हम लोग स्ट्रेस से उबर जाएं। तो ये दो क्वेश्चंस वो पूछ रहे हैं कि तो एक तो है कि एनजीओ और सीएसओ क्या कर रहे हैं और क्या ज़्यादा करना चाहिए, और इंडिविजुअली हम लोग कैसे इससे उभरे? थैंक यू। डॉक्टर साहिल।
जी, थैंक यू फॉर द क्वेश्चन। तो इसमें जो सीएसओज और एनजीओज कर सकते हैं उसमें हमारे तरफ से दो तीन जो हमारे एक्सपीरियंस है उसके हिसाब से सुझाव रहेंगे। एक तो अगर हम एक पीयर ग्रुप बना सके गांव में या जो ग्रामीण क्षेत्र में बहनें बैठती है, भाई भाई बैठते हैं, उधर अगर हम एक पीयर ग्रुप बना सके उन्हीं के जेंडर का, तो दैट इज वेरी हेल्पफुल नॉट ओनली फॉर मेंटल हेल्थ इश्यूज बट जेंडर बेस्ड वायलेंस के लिए भी। और इसके जो पायलट्स है वो दुनिया के कई कोने में किए गए, एंड स्पेशली फॉर जेंडर बेस्ड वायलेंस इट्स प्रूवन टू बी वेरी इफेक्टिव। तो एक पीयर ग्रुप अगर हम बनाए जिसमें पीयर ग्रुप सपोर्टर्स को बेसिक तालीम दी जाए ऑन व्हाट आर द इश्यूज एट हैंड, व्हाई डू दे अकर, एंड व्हाट आर द थिंग्स दैट दे कैन से एंड दैट दे शुड अवॉइड सेइंग। अगर इन सब चीज़ों पे अगर उनको तालीम दे, दैट बिकम्स वेरी इफेक्टिव। बिकॉज बाहर से कोई आकर एक गांव में किसी को समझाए वो उतना इफेक्टिव नहीं है जितना उसी गांव के बहनों को और भाइयों को अगर हम तालीम दे तो, क्योंकि दे हैव द फेथ एंड ट्रस्ट ऑफ द कम्युनिटी, they are able to relate to the customs and rituals and the local context much better than an outsider coming in. So that would be one suggestion. The other is खास करके बच्चों के लिए जो डॉक्टर जय कुमार ने कहा उसके ऊपर मैं ये कह सकता हूँ कि सेवा ने कोविड के वक्त ये एक एक्सपेरिमेंट शुरू किया था। हमने एक कैंपेन शुरू किया था जिसका नाम था समय नु सम्मान। मतलब हम बच्चों को किस तरीके से अलग अलग कंपटीशन में, एक्टिविटीज में इन्वॉल्व कर सके ताकि उनका मन बना रहे। तो हमने बहुत सारे पोस्टर कंपटीशन, एसेस, फिर सॉन्ग्स और इन सब के ऊपर कॉम्पिटिशन्स रखे थे, और उसका बहुत प्रभाव कोविड के वक्त पड़ा था। एंड पिछले 4 साल में हमने ये दो तीन और चीज़ों पे बच्चों को इन्वॉल्व किया हुआ है। एक है जो पूरा सेवा का क्लीन स्काईज कैंपेन है विच इज आवर फाइट अगेंस्ट क्लाइमेट चेंज। दूसरा मेंटल हेल्थ का जो हमारा पूरा कार्यक्रम है उसमें भी हमने बच्चों को इन्वॉल्व किया हुआ है। तो इफ वी कैन एंगेज चिल्ड्रन इन फन एंड मीनिंगफुल एक्टिविटीज which provides them a distraction and tries to reduce their stress, I think that's a very important initiative. और तीसरी चीज मैं ये कह सकता हूँ कि a lot of times रूरल एरियाज में एंड इन अर्बन स्लम्स द की डेटरेंट टू मेंटल हेल्थ वेलबींग इज एक्सेस टू केयर। तो अगर हम एक साइकाइट्रिस्ट को उधर लोकली लेकर आ सके, या जो साइकोलॉजिकल काउंसलर्स है उनको उधर लेकर आ सके और कैंप्स कर सके, भले लिमिटेड बेसिस में बहनों को फायदा मिले मगर उसका फायदा जरूर मिलता है। तो हमने ये भी दो तीन जगह पे किया हुआ है, और उसमें एटलीस्ट बहनों को लगता है कि उनकी बात कोई सुनने के लिए तैयार है। तो अगर हम इस तरीके से कैंप्स कर सके मेंटल हेल्थ एंड वेलनेस के लिए, आई थिंक दैट प्रूव्स टू बी इफेक्टिव। So those were the three key suggestions that we can share, Mehul bhai. Sorry, I forgot the second question.
सेकंड क्वेश्चन।
आपकी आवाज नहीं आ रही।
सेकंड क्वेश्चन उसके बारे में था कि अगर व्यक्तिगत लेवल के ऊपर अगर मुझे शॉक लगा है, या मुझे लग रहा है कि मेरा मेंटल बैलेंस अभी ठीक नहीं है, तो उसको सही करने के लिए मैं इंडिविजुअली क्या मेजर्स या स्टेप्स ले सकता हूँ या ले सकती हूँ, ऐसा पूछा गया है।
हाँ, मतलब ये बहुत ही कॉम्प्लेक्स टॉपिक है। इट्स अ गुड क्वेश्चन, मगर बहुत ही कॉम्प्लेक्स टॉपिक है, एंड इसमें हर एक इंडिविजुअल का जो रिस्पॉन्स होगा, जो उनके लिए काम करेगा, वो बहुत ही अलग चीज होगी। आई एम नॉट अ मेंटल हेल्थ एक्सपर्ट, बट मैं इतना कह सकता हूँ कि एटलीस्ट अगर उस व्यक्ति को थोड़ा मेंटल हेल्थ का अवेयरनेस हो, या एज अ सीएसओ एज ए एनजीओ अगर हम वो क्रिएट कर सके कि ये जो पूरा स्टिग्मा है वो कम कर सके, दैट इट इज ओके टू हैव अ मेंटल हेल्थ इलनेस एंड इट इज ओके टू सीक सपोर्ट फॉर मेंटल हेल्थ, एंड इट इज ऑन पार विद फिजिकल हेल्थ अल्टीमेटली, राइट। अगर हमें आज कुछ भी बीमारी होती है तो हम तुरंत डॉक्टर के पास चले जाते हैं, लेकिन मेंटल हेल्थ के लिए अभी तक वो अवेयरनेस नहीं है। एंड इस फोरम में बहुत सारे लोगों को ये पता भी है कि ये स्टिग्मा प्रेवलेंट है, सिर्फ हमारे देश में नहीं, बाहर के देशों में भी। तो अगर एज अ सोसाइटी, एज एनजीओ, एज सीएसओज वी कैन क्रिएट अवेयरनेस कि मेंटल हेल्थ इज एक्सट्रीमली कॉमन, मेंटल हेल्थ इश्यूज, एंड उसके लिए मेंटल हेल्थ काउंसलिंग या डॉक्टर के पास जाना कोई बुरी बात नहीं है, आई थिंक दैट्स द फर्स्ट स्टेप। and making a person realize with mental health that उनको ये बीमारी है और इसका इलाज है, I think that's a big step in the right direction. लेकिन उसके बाद जो व्यक्तिगत उनको स्टेप्स लेने हैं, that can vary from something as simple as regular routine exercises, music, meditation, anything else that works, to seeking care, seeking medication. So that's a wide range of interventions that physician, I mean, basically psychiatrists can decide on an individual basis. So I don't think there's a one solution fits all here, but हर व्यक्ति का जो रिस्पॉन्स रहेगा वो अलग मुद्दों पे अलग अलग तरीके से रहेगा.
थैंक यू सो मच साहिल भाई फॉर द आंसर. और अगर डॉक्टर अनिल गुप्ता है तो एक एडिशनल क्वेश्चन है सर कि फ्रॉम द पॉलिसी पॉइंट ऑफ व्यू हम लोग मेंटल हेल्थ के सपोर्ट सर्विसेज को ज़्यादा से ज़्यादा पुअर कम्युनिटीज एक्सेस कर पाए, तो उसके लिए हम लोग ग्रास रूट लेवल के ऊपर, तालुका लेवल के ऊपर या डिस्ट्रिक्ट लेवल के ऊपर कौन से चीज़ों को हम लोग बढ़ावा दे सकते हैं. हम लोग वो लोग अगर मेंटल हेल्थ सर्विसेज को एक्सेस करना चाहे तो वो लोग कहाँ जाके एक्सेस करें. तो उसका अगर आप कुछ स्ट्रेटेजीज या कुछ हल हमको बता पाए तो दैट विल बी वेरी यूजफुल टू आवर पार्टिसिपेंट्स. गुप्ता सर है क्या? मुझे लगता है कि ठीक है. और दूसरा एक क्वेश्चन है.
जी मेहुल जी, जस्ट आई जस्ट
यस
वांट टू कम इन हियर.
यस सर.
दो चीज़ है. द एक्सेसिबिलिटी इशू एट द ग्रास रूट लेवल. देखिए, ऑलरेडी देयर इज एक्चुअली प्रोग्राम, डिस्ट्रिक्ट मेंटल हेल्थ प्रोग्राम. वो एक्चुअली हर डिस्ट्रिक्ट में है. एक मेंटल हेल्थ टीम है कंप्राइजिंग ऑफ साइकाट्रिस्ट, साइकोलॉजिस्ट, साइकेट्रिक सोशल वर्कर एंड साइकेट्रिक नर्स. वो एक्चुअली एवरी डिस्ट्रिक्ट में है. वो जनरल हॉस्पिटल, डिस्ट्रिक्ट हॉस्पिटल में, उसमें भी एक्चुअली ये लोग अटैच्ड है. ये लोग एक्चुअली द रेडीली अवेलेबल ग्रास रूट लेवल फैसिलिटी एट दिस पॉइंट ऑफ अ टाइम इन आवर कंट्री. वो एक्चुअली उनके साथ साथ प्राइवेट साइकेट्रिस्ट है, इंस्टीट्यूशंस है, डिपार्टमेंट ऑफ साइकेट्री है, मेडिकल कॉलेजेस है, जो भी है at the secondary level or a tertiary level. But another aspect is that government of India is actually also trying to reach out to the grassroots level. So NIMHANS actually is implementing telemanus program. तो ये एक्चुअली पूरा 27 स्टेट्स में एक्चुअली अभी इट इज़ एक्चुअली गोइंग ऑन. 24/7 हेल्पलाइन है और 20 इंडियन लैंग्वेजेस में एक्चुअली ये चल रहा है. तो आज तक एक्चुअली ये 6-7 लाख एक्चुअली कॉल्स ले चुके हैं. और ये एक्चुअली इन कोऑर्डिनेशन विद वेरियस लोकल इंस्टीट्यूशंस के साथ, प्रोफेशनल्स के साथ हो रहा है, चल रहा है. तो ये टेलीमानस एक्चुअली इज वन वे ऑफ रीचिंग आउट टू द पॉपुलस थ्रू द टेक्नोलॉजी. बेसिक मोबाइल फोन से एक्चुअली ये लोग एक्चुअली कॉल कर सकते हैं. एंड दिस एक्चुअली वर्क्स ऑन 3 शिफ्ट बेसिस. सो दिस इज एक्चुअली उधर एक्चुअली ट्रेंड काउंसलर्स रहता है हर स्टेट्स में, and they are being monitored, they are certified by us, and they will be actually guiding these people actually that when they call for any sort of a support. ये actually last 1.5 years actually से ये functioning हो रहा है. And this is actually one way of actually reaching out to the populace. So this is also actually can be accessed. People should know about this number, Telemanus. It actually comes. It's readily available in Google. So that is actually the another way of actually present actually. मैं प्रेजेंट कॉन्टेक्स्ट के लिए बोल रहा हूँ. हीट वेव है, आप किसी को एक्चुअली कुछ प्रॉब्लम है, कॉल टेलीमानस हेल्पलाइन. बोलना है आपको एक्चुअली क्या चल रहा है, क्या हो रहा है, आपको क्या चाहिए, तो वो लोग एक्चुअली विल बी एबल टू एक्चुअली गाइड यू.
और ये सब सर्विस कौन से लैंग्वेजेस में अवेलेबल है करंटली?
20 इंडियन लैंग्वेजेस में अवेलेबल.
yes. और कुछ पार्टिसिपेंट्स उसका हेल्पलाइन नंबर भी मांग रहे हैं, तो आई थिंक दैट विल बी अवेलेबल. वेबसाइट के ऊपर होगा ना सर?
वेबसाइट टेलीमानस लिख दीजिएगा गूगल में टेलीमानस.
यस.
हाँ,
थैंक यू.
टेलीमानस,
हाँ ना.
मेंटल हेल्थ. हाँ, टेलीमानस हेल्पलाइन नंबर लिखा तो आ जाता है. हिंदी में भी आ जाता है, कन्नड़ा में है, गुजराती में है, मराठी में है, सब कुछ में. इवन नॉर्थ ईस्ट का लैंग्वेजेस में भी है.
बहुत बढ़िया, थैंक यू सो मच। और दूसरा एक सवाल है सर, नुपुर त्यागी पूछ रहे हैं कि मेंटल illnesses are a result of a many diverse reasons. So how do we then access the increase in cases of mental illness among people due to heat waves and not due to other reasons, especially people already dealing with long-term mental health illnesses? तो वो बेसिकली पूछ रहे हैं कि मेंटल हेल्थ इलनेस हीट वेव के कारण है या दूसरा उसका और अलग कुछ रीजन है, तो वो डिफरेंशिएट कैसे करें हम लोग और उसके साथ कैसे डील करें?
Heat wave actually a triggering event. ऑलरेडी मेंटल इलनेस किसी का हो सकता है ड्यू टू जेनेटिक रीजंस, ड्यू टू केमिकल इम्बैलेंसेस, मे बी स्ट्रेसेस, मे बी एक्चुअली certain lifestyle this one, or maybe due to alcohol. ये सब के वजह से एक्चुअली उनके ऊपर ऑलरेडी एक्चुअली और he must have carried that gene also actually from his previous this one. तो ऑलरेडी उसका predisposition है और ऑलरेडी एक्चुअली he is actually mentally ill और स्टेबिलिटी चल रहा है और समवेयर एक्चुअली इज नॉट डायग्नोस्ड, बट हीट वेव के वजह से एक्चुअली स्ट्रेस बढ़ रहा है, तो वो एक्चुअली ट्रिगर जैसा एक्चुअली एक्ट कर सकता है। तो यही एक्चुअली फर्क है। और आपको कैसे आइडेंटिफाई करना है, मैं तो बोल रहा हूँ आपको आइडेंटिफाई करना है उसका हाव भाव में कुछ परिवर्तन है, उसका एक्चुअली काम करने में कुछ परिवर्तन है, तो अकेले बैठ जाता है आजकल, एक्चुअली किसी के साथ नहीं बात कर रहा है और किसी के साथ ज़्यादा बात कर रहा है। मैं बोल रहा था बाइपोलर अफेक्टिव डिसऑर्डर, मेनिया में चले जाते हैं लोग और जब ज़रूरतें ज़्यादा बात करते हैं और पूरा आत्मविश्वास से बड़े बड़े बातें बोलते हैं, एक जगह पे नहीं बैठते हैं, बहुत रेस्टलेस रहते हैं, ज़्यादा एक्चुअली जैसा ताकत जैसा ये करते। सो दिस इज एक्चुअली आई एम टॉकिंग अबाउट सम सिम्टम्स ऑफ बाइपोलर एक्चुअली, दैट आर पीपल हु आर नॉट टॉकिंग, हमेशा अकेले रहते हैं, किसी काम पे एक्चुअली मन नहीं लगाते हैं। तो ये सब एक्चुअली, सो दैट इज व्हाई एक्चुअली दैट यू हैव टू identify actually change in the physical aspects of the person, identify change in the भाव में, हाव भाव में और व्यवहार में और सोच में, ये सब में एक्चुअली कुछ परिवर्तन है, एक्चुअली इसका एक्चुअली ठीक नहीं चल रहा है, then actually you can actually consult or you can even actually call this telemanus helpline. They'll be able to actually guide you, or you can go to a nearest psychiatric or mental health professionals available, or people who are in the government sector, district hospital or DMHP team और बड़ा मेडिकल कॉलेज में है, तो ये सब। एंड हीट वेव में आई वुड एक्चुअली से दैट हीट वेव में बाहर जाकर इतना गर्मी में ये सब बहुत लंबा लाइन में खड़े होकर और एक गवर्नमेंट फैसिलिटी में, ये सब एक्चुअली प्रैक्टिकल हमें पता है। द बेस्ट इज पिक अप योर फोन एंड कॉल दिस टेलीमानस।
ओके, थैंक यू सो मच सर। ये
and
स्किल है।
I mean all those organizations who are here, other than physically reaching out to these people, you can actually also use the technology to reach out to these people, because we have a severe resource crunch in the trained professionals or mental health professionals. तो 144 population के लिए we are not even 10,000 mental health professionals are available. Look at the ratio. So we need to actually decentralize, we need to actually bring in more synergies, more hands from other professions or other disciplines also, so that everybody can actually provide some amount of mental health care and support.
हमारे पास अभी भी 7 या 8 मिनट्स है, तो अगर कोई पार्टिसिपेंट अपना क्वेश्चन पूछना चाहता है तो पूछ सकता है। और मीनवाइल आप अपना प्रश्न सोचे, हैंड रेज करें या चैट बॉक्स में लिखे। मेरा एक क्वेश्चन था कि जैसे जया कुमार जी और डॉक्टर साहिल जी, अमेरिका के अंदर वो लोग मई मंथ को सेलिब्रेट करते हैं मेंटल हेल्थ अवेयरनेस मंथ के रूप में, और वो ये लोग कर रहे हैं 1949 से कर रहे हैं। एवरी मे मंथ जब भी आता है तो उसको सेलिब्रेट करते हैं वो लोग, और हर एक साल को वो अलग अलग थीम रखकर उसको सेलिब्रेट किया जाता है। तो ये पर्टिकुलर मे 2024, तो वो लोग इस साल का थीम रखा है वेयर टू स्टार्ट, और मेंटल हेल्थ इन चेंजिंग वर्ल्ड करके रखा है। तो क्या हमारे देश के अंदर भी क्या ऐसा कोई दिन है या ऐसा कोई वीक है या ऐसा कोई मंथ है जहां पर हम लोग मेंटल हेल्थ क्यों इम्पोर्टेंट है उसका जागरूकता के लिए उसका सेलिब्रेशन करते हैं, और अगर करते हैं तो उसमें दूसरे एनजीओ, सिविल सोसाइटी या सिटीजन्स कैसे पार्टिसिपेट कर सकते हैं? थैंक यू।
जी, आपने सही बोला था। उधर एक्चुअली नॉट ओनली मेंटल हेल्थ डे को करते हैं, जब हम न्यूयॉर्क में देखा है, इवन फायर सेफ्टी के लिए एक दिन रखता है। उस दिन पूरा फायर वाले को एक्चुअली लेता है, अवेयरनेस करता है। तो इतना अवेयरनेस हर एक चीज़ में वो लोग करते हैं। तो इधर एक्चुअली वर्ल्ड मेंटल हेल्थ डे है, वो अक्टूबर 10 सेलिब्रेट हो जाते हैं। तो उस टाइम में पूरा देश में कई कई विभागों में, इंस्टीट्यूशंस में, एजुकेशनल इंस्टीट्यूशंस में है, मेंटल हेल्थ प्रोफेशनल्स है, हॉस्पिटल्स में, सब एक्चुअली ये सेलिब्रेट करते हैं आजकल। वो भी एक्चुअली इधर भी एक्चुअली हर एक साल ये WHO का है। ये WHO एक्चुअली डिक्लेयर करता है वर्ल्ड मेंटल हेल्थ डे। हर एक टीम पे एक्चुअली हर एक साल एक टीम पे एक्चुअली हो जाते हैं। और आजकल एक्चुअली दैट एक पूरा हफ्ते, पूरा 2 दिन 3 दिन एक्चुअली ये सब सेलिब्रेट करता है। बाहर एक्चुअली जाने के लिए भी एक्चुअली लोग पूरा जनरल पब्लिक इन्वॉल्व भी एक्चुअली होते हैं, बट इतना ज़्यादा नहीं होते हैं जितना होना चाहिए। तो हम लोग एक्चुअली एक इनिशिएटिव किया है। हम लोग इसको कॉल बुलाते हैं संते। संडे मीन्स इन कन्नड़ा, in Bangalore, market, weekly market. So हम लोग actually mental health weekly market, if I put it in English. So mental health Sante we are actually we celebrate organize करते हैं 2 दिन जनरल पब्लिक के लिए। तो सबको एक्चुअली बुलाते हैं, सब पॉपुलेशन, स्कूल, सबको इनवाइट करते हैं। तो उधर एक्चुअली हम लोग वो अवेयरनेस करते हैं कि मेंटल हेल्थ इलनेस क्या है, कौन कौन इसको अफेक्ट होता है, क्या क्या चीज़ से एक्चुअली इसको पीड़ित हो जाते हैं लोग, कैसे इसको अवॉइड कर सकते हैं, क्या चीज़ को प्रिवेंट कर सकते हैं, कैसे इसको इलाज कर सकता है, कौन इसको इलाज कर सकता है, कहाँ जाकर इसको इलाज ले जाना लेना है, और कितना साल तक एक्चुअली इसको ले जाना चाहिए, और क्या क्या साइड रिएक्शंस है। One of the important aspect in heat wave is people who actually go for a hospitalization, or people who die also due to certain medications or psychiatric medications. One or two medications actually can actually reduce your increase this risk. So that is why actually that people who are actually already on medication are actually need to be actually monitored. It is just not actually people who are non-medication, people who are actually taking medication also to be monitored. So ये सब actually हम लोग outreach करते हैं, जैसा हम child parliament करते हैं, है ना। लोग child parliament is very famous. So why can't organizations can think of mental health parliament for different people? I'm just putting this actually to all of you. Can think, because at the end of the day, job actually it is everybody hands to come in, and whoever is actually doing at actually the ground level, and we will be always ready to actually support it from Nimans. So because Nimans also actually would like to actually take the local expertise, people's actually resources to actually take this forward. So we actually have. I mean, year after, I mean, it can be celebrated. Not only the institutions like us, why even general public can celebrate. Even organizations can celebrate. Everybody can celebrate with one team and awareness program and many others.
Yes, yes, thank you so much for the responses. uh, और कोई लास्ट क्वेश्चन हम लोग ले सकते हैं? अभी 3 मिनट जितना समय हमारे पास बचा है, किसी को कुछ पूछना है? एक क्वेश्चन आया है सर, कि हाउ मेनी मेंटल हेल्थ प्रोफेशनल्स आर इन इंडिया, वन इन ईच डिस्ट्रिक्ट हॉस्पिटल्स?
No, वो डेटा मेरे हमारे पास नहीं है, बट आई वुड quote actually from 2016-17 National Mental Health Survey, and subsequent actually all this reports, internal, external, roughly actually it is estimated around 10,000 mental health professionals, that including psychiatrists, psychologists, psychiatric social workers, psychiatric nurses. जितना ही है. We don't have data from district wise.
यस सर। और दूसरा, अगर मैं इसी क्वेश्चन में जोड़ दूं सवाल, क्या आपको लगता है कि जितना भी है प्रोफेशनल्स फॉर दिस एरिया, क्या वो एडिक्वेट है हमारे कंट्री के साइज के हिसाब से?
Can immense go to all disaster prone areas? Of course, हम लोग actually जितना भी disasters हो रहा है, उधर हम लोग actually on the invitation of either the state government or actually the government of India will deploy us. Based like हम लोग actually कई disasters में था, local government को, local institutions को, professionals को, both government, non-government, everybody को support करते हैं. Yes, of course, ये actually हमारा mandate भी है. And it is need not be only government actually हमको बुलाना है. Like Spear India बुलाया है, मैं गया है उत्तराखंड, और कई जगह पे actually गया है, और सेवा 2001 actually closely involved with NIMANS in putting up actually psychosocial care for the this community women. I mean, anybody can actually seek and collaborate with NIMANS in any disasters. We'll be happy to come. But not somebody is actually also talking about not at all. We don't have a mandate to actually go independently because we are a government organization. So we need to actually seek appropriate permission from the respective states and government of India. And many a times we go there on the collaborative with the NGOs also. So I would not actually say that everywhere we are there. We are supposed to be there, and wherever is requirement based on the situation, we will be there.
Okay, thank you so much, sir.
Yeah, government of Odia, always somebody is actually talking about government of Odia as always. So, like fifth, actually, that OSDMA is going to sign an MOU with NIMANS. That actually includes providing training, doing research, also actually getting deployed whenever there is actually any eventuality happens in this one. So this is actually a lot of things going on. So next week we are going to actually going to sign an MOU with OSDMA. That is for the Kalika Mahapatra. Thank you.
Thank you. So it's time. We need to close the session. And before we do that, I would like to request Fear India to give vote of thanks. Thank you.
Thank you so much, Mehul sir, for moderating the session. It was a wonderful session and indeed a very crucial topic. Mental health was a few years back, it was kind of ignored, but I'm very happy that there is more conversation happening, and I'm very happy about the work that Enhance is doing. Especially thank you so much for all the speakers who attended this session, Dr. Sahil, Dr. Anil sir, and Dr. Jaikumar. Thank you so much for coming and spending some time with us despite of your busy schedule. We really appreciate it. And also a big thank you to our moderator for the session, Dr. Mehul sir. Thank you so much for very efficiently facilitating the session. And also I would like to thank all the participants. And before closing, I just wanted to let you all know that this is a series of sessions. This is our 5th session that we are doing on different aspects of heat wave. So we also got a request from you all to do a session in regional languages. So we'll have one session in Gujarati tomorrow. It will happen in the same time, 3 to 4:30. And Monday, we'll have a session in Rajasthani regional languages, and it will also have Hindi as one of the major, language. So you will receive the emails regarding the joining link and other details. So please, stay connected with us. We'll let you know, and we hope to see you for the upcoming sessions. Once again, thank you to all the speakers and all the participants. Thank you so much. Thank you so much.
Thank you. Bye-bye.
Thank you, Dr. Mehul, Dr. Anna. Thank you.
Thank you,
Thank
sir.
you, everyone. Namaste.
Thank you. Namaste. Bye-bye.
Namaste, sir.